examples that I thought were really helpful examples from the Society of Internal Medicine. So a PCP sees their established patient with hypertension for a walk-in visit. They also talk about the sore throat. And so the PCP talks about over-counter remedies, and then wants to make sure that there's no issues with raising the blood pressure. So because they have an acute issue, but then they also have the chronic hypertension, the physician's kind of thinking about both things at once, and they've got that documented history with the patient, then that could be an appropriate use. Another example would be a patient presents to their PCP for their annual wellness visit, and then they also talk about the patient's diabetes and hypertension. That would not be an appropriate use because you can't bill an annual wellness visit with G2211. Another example, patient presents a brand new patient and needs to establish care. They have hypertension and diabetes. So now that PCP is going to assume the ownership of those chronic conditions, work them up, manage them. And so at that point, G2211 could be reported. A nurse practitioner sees an established patient for their diabetes, hypertension, CHF, and then basically assumes the management of that. That could be an appropriate use. Again, it doesn't just have to be a physician. It can also be a nurse practitioner or a physician assistant. PCP sees an established patient for mental health. Patient is given a new antidepressant. So G2211 could be billed during a telehealth visit, so it doesn't just have to be done for in-person visits. And then patient sees a provider for diabetes, and then they go to see another, PCP sees a patient with diabetes who's established with another provider in their practice. That provider is out sick, so that PCP sees the patient and discusses the diabetic foot ulcer, changes their diabetes medication. That could be an example of the team-based care approach rather than that provider-patient relationship. So it should not be billed for every patient. It should not be billed for straightforward complaints. This is not a way to offset your Medicare reimbursement cuts.